This is always the fun part. She made it. It
Hello.
worked.
How are you?
I'm good. How are you? Are you freezing? Is there
I
snow everywhere?
can you tell I'm freezing and I'm home with a family filled with kids and husband with flu.
Yeah. I've already talked to two people this morning who are just completely KO'd. I mean, it's hitting everyone. Yeah.
Everyone, everyone.
Yeah.
So we're cold and we're sick,
Oh,
but
super.
all that aside, life is grand.
Oh, fantastic. Well, I'm glad to see your face this morning. And I'm glad you're not good, that you haven't gone down.
Yeah, hopefully, knock on wood, I'm on a prophylactic dose of Tamiflu
Okay.
per the doctor's recommendation. So
Yeah.
I'm just trying to get through
Yeah.
this without getting knocked down as well. We'll see.
Okay, well, I'm gonna manifest that for you really a lot as soon as we get off this Instagram live.
Thank you. Thank you. I'm using everything I know as a registered dietitian, staying hydrated, eating my whole foods, getting plenty of rest, managing my stress, all the things.
Mm-hmm.
So hopefully I will come out of this,
Unscathed,
unscathed.
unscathed.
Yeah.
Well, let's introduce you to everybody who's joining. Hi, everybody who's hopping on here. We are so fortunate this morning to have Daria Ventura, who is a registered dietitian, a certified nutritionist, an all around wonderful person. So we're so grateful to have her here. Can I just give a little bit of your background because
Sure.
it's number one, it's relevant, but number two, it's supremely impressive. So
Thank you.
I always like to just kind of calibrate who we have on. Daria received her Master's of Science in Clinical Nutrition from NYU, that's New York University. She is in private practice. She has her own practice, Daria Ventura Nutrition, which we're going to put all of the information in at the end of this. And so she is both a consultant and a clinician for her patients, and is she's not just a nutritionist and a registered dietitian, but she's also a certified wellness coach. And she also has her certificate in weight management for adults. Am I saying that correctly?
Yep.
So she
I
just,
actually have in adults for adults and kids, but
oh, for
I'm now
adults.
primarily working with adults. So
Um, so she has lots of certificates. She keeps going back and getting more. So we're constantly having to update her bio. And she's in Larchmont, New York. So um, we always love going to New York, but she also sees patients virtually, of course. So again, we will put all of that information because she just launched her brand new website and it's beautiful. And we're so grateful that she is joining us this morning. And she is a HotPause Health Nutrition Advisor. And one of the topics that continues to come up, not just with our community at HotPause Health, but kind of, I would say, in the US in general, given our historic relationship with food and some pretty bad habits I think that have happened over the years, is type 2 diabetes, insulin resistance, and just kind of general health risks around that disease state. And so if you don't mind, Daria, can we start at the very beginning as one of my favorite musical, Sound of Music. Let's start at the very beginning. It's a very good place to start. What is type 2 diabetes and how is it different than type 1?
yeah. So let's just start with the basic science. So in simple terms, type 2 diabetes is basically a condition where the body struggles to manage blood sugar levels, otherwise known as glucose, blood glucose, effectively. And this happens because either cells can become more resistant to insulin over
Mm-hmm.
time. Insulin being the hormone in the body that is necessary to pull blood glucose or sugar from
Mm-hmm.
the bloodstream into the cells to be used for energy. Or it can happen because the body is not producing enough insulin. Insulin is produced in the pancreas. And so there are conditions where the body just isn't producing
Mm-hmm.
enough. So over time, what can happen is elevated blood sugar levels can contribute to chronic conditions, including things like type 2
Mm-hmm.
diabetes, but also heart disease, nerve damage,
Yeah.
kidney issues, and so on. So Really important that we're, paying attention to our diet and lifestyle habits. And the good news there is that um, type 2 diabetes is often preventable and manageable with dietary and lifestyle changes. The difference between type 2 and type 1 is when the body really isn't producing insulin. So for those individuals who have type 1 diabetes, they will require hormone therapy in the form of insulin.
Yeah. And it is something that just happens to their bodies
Correct.
typically in childhood.
Correct.
Okay.
Correct. Type 2 develops over time.
Okay. So with type 2, why are women in particular, as we age, we're going through midlife, why is that risk of type 2 increasing in as we grow and
Yeah.
age?
Yeah. So, any time is an important time of life to really be paying
Hmm.
attention to your biomarkers, but certainly midlife poses additional challenges, especially for
Right.
women, primarily driven by hormonal shifts. So, for women in midlife, hormonal shifts, especially declining levels of estrogen, make it much more difficult for women to be able to manage blood sugar levels. We
Hmm.
know that estrogen is really quite protective against insulin resistance. So, as estrogen levels start to decline, insulin sensitivity
Hmm.
decreases, which can lead to rising blood sugar levels. But it's not just the hormonal shifts. I mean, hormonal shifts, yes, that come with this stage of life,
Right.
but we also need to think about other menopause related stressors, things like hot flashes, sleep disruptions, weight gain that women experience at this stage of life, added responsibilities at home and at
Right.
work. All of these stressors can contribute to higher cortisol
Right.
levels, cortisol being the stress hormone in the body, which in turn elevates blood sugar levels. So, as I said earlier, the good news here is that, specifically with type 2 diabetes, there are things that we can do to prevent and manage from a diet and lifestyle standpoint. Um, and it's important to not just focus on nutrition, what you're eating, how much you're eating, why you're eating, food timing, and all the things, but to also think about all the pillars that make up a healthy lifestyle. Things like sleep
Right.
optimization, stress management, how we're moving our bodies. Again, for women at this stage of life, we're taking on so much more responsibility. Plus, we're feeling all the symptoms that come with hormonal shifts, which can contribute to things like fatigue. So it's very easy to put ourselves last and prioritize everybody else in our lives, which can lead to things like more sedentary behavior, poor food choices, going to bed late, fatigue, and all the things. So we want to make sure that we're looking at the full picture. And the good news is, again, I keep repeating myself, but the good news is there is so much that women can be doing from a diet and lifestyle standpoint.
Well, I think that's something that comes up often, right? That this overwhelmed kind of predicament that we're in this sandwich generation where you're raising kids, whether they're teenagers or little guys, because you had, kids late, and then aging parents, whole nother subject,
Yeah.
very stressful. And you're trying to have a career potentially, and you're working and you're doing all the things. And I think that oftentimes we get paralyzed, and what we hear a lot from our community is what's in my
Mm-hmm.
control, and would love to hear from you in terms of those levers. I mean, you've mentioned nutrition, you've mentioned sleep, you've mentioned exercise. What are really specific things that women can do to lower that risk at a close in, achievable way? Again, I think that's something that for me anyways, if it's not achievable, I'm like, I'm done. I'm
Right.
not going to even try. That's
Right.
ridiculous. How do we very, intentionally start small to then ladder up and scale, and scaffold that
Mm-hmm.
behavior? And what are those things that are in our control to help
Yeah.
that proactive prevention?
Yeah, no, that's a great question. So let's break it down. We can
Yeah.
go sort of pillar by pillar, but before I do that, I just also want to emphasize that everybody is unique. So what's doable for some may not be doable for others. The good
Yeah.
news is there are a lot of options, and I would recommend and suggest that anyone listening to really focus on the areas where you feel you're going to have the biggest wins and be most successful.
Yeah.
You do not, I'm going to go through a fair bit.
Right.
You don't need to tackle all of these things at once.
Right.
Again, focus on the areas where you feel confident you're going to have the biggest wins. And equally important, we see much greater benefit when you are focusing on a few things and being really consistent with those things, as opposed to trying to tackle many things all at
All of it.
once.
Yeah.
So if you haven't heard of James Clear or the book Atomic Habits, I really recommend that you read it. It is an excellent book in helping people to break unhealthy habits and to form healthier habits. So
Yeah.
if you haven't read it,
James Clear.
go out and buy yourself a copy, or
Okay.
get it from the library. Okay, so starting with
Yep.
nutrition first, there are a couple of
Mm-hmm.
things. So first and foremost, I would suggest that everybody assess their food quality. The quality of the food that you are eating is probably number one. And the
Mm-hmm.
reason why I say this is because if you give your body what it recognizes most easily,
Mm-hmm.
we're thinking whole foods, organic foods when possible, and you're avoiding the foods that it doesn't recognize, packaged processed foods, foods that have additives or chemicals, you're going to keep your digestive system working well, and that helps to deliver nutrients and eliminate any of the
Yeah.
unwanteds. So eating a high quality diet, or a diet that's, high in quality foods, is really a key foundation here. And it can really help you to avoid consuming those irritants, which can also be endocrine disruptors, which can further challenge hormones in your body, like insulin. So, if you want insulin to be working efficiently and effectively, we want to make sure that we are consuming high quality, nutrient dense foods, while at the same time avoiding those foods that are irritants, endocrine disruptors, and can challenge insulin and insulin's response. So that's first and foremost, is assessing diet quality.
Can I pause
Okay.
for one second
Yeah.
here? To me, it becomes, and I feel like oftentimes it's overcomplicated and macros and this and counting. It's like, no, no, you know what the foods are. We've been learning this probably since kindergarten when you went through the food groups, and it's fruits and veggies, plant forward, whole proteins, nuts and seeds, a lot of water,
Right.
right? Like not that much alcohol or none. Now that we're hearing all of this, sort of general warning, but it's simple. And if I think that the overcomplicating or needing to figure things out, it's like, nope, just go shop the perimeter of that store,
Right.
buy things that are whole, that aren't processed. If you can read the ingredients, they should be pretty simple.
Right.
And that's it. Like, don't
Yep.
overcomplicate it, I think is something that we often say to our community. Like, you got it. You're a smart lady.
Yeah.
Rock and roll.
Yeah, yeah. But other things influence our
Yeah.
choices, right? Our stress level, how much sleep we're getting, marketing, all of these things can
Yep.
influence our food choices. But you brought up a really good point, which is, something as basic as label reading, picking up the label for products, reading the nutritional information, reading the ingredients list. I generally, say to clients, choose items with few and familiar ingredients. The
Right.
shorter the list, the better. And if there are ingredients on the list that you can't pronounce or you don't understand, put it back on the
Yeah.
shelf. Okay.
Okay. Next
Um,
lever. Next lever that we can pull.
okay. So the second thing, we're still with nutrition, we haven't gone beyond nutrition yet, is making sure that you're following a regular eating
Right.
schedule. So food timing becomes really important. We want to make sure that we're eating at consistent times throughout the day. Research does show, and understanding that there's no one size fits all,
Right.
right? And everybody is unique, but there is research that shows that eating consistently throughout the day, roughly every 3 hours or so, can help to control and stabilize blood
Right.
sugar and stabilize blood sugar. And we know that when blood sugar is more stable, we get other benefits, right? we have more energy, our hunger level is more controlled, we have fewer cravings, our mood is better. So we're not just working on stabilizing blood sugar to stabilize blood sugar, right? We're working on stabilizing blood sugar so that we get all these other added benefits.
Yep.
Okay, so food timing is important. One additional note there is that I do recommend that people set a cutoff time in the evening, generally around 7 or 8 p.m.
Yeah.
or 2 to 3 hours before you're going to go to bed, especially if you're not active at that time.
Right.
And the reason why I say that is because your body isn't demanding more energy when you're winding down or you're watching TV.
Right.
So you don't really need food at that time.
And what
So
happens if you go to bed and you eat this huge, I think I'm going to have a big old dinner and then I go to bed? What happens? Why is that bad?
well, you could develop rapid spikes or rapid falls in your blood sugar that can throw off the quality of your sleep.
Okay. Got it.
So we want to try to give the body at least 2 to 3 hours to digest food, and stabilize that blood sugar before going to bed.
Perfect.
Okay.
Keep it
And just
even.
yeah, and a little preview to when we get to movement is a simple, easy action of taking a short walk after meals. I mean, I know for me in New York, it's freezing outside right now. So when it's dark and freezing, may not want to do that. But you'll learn that any movement after meals is really great for for improving insulin sensitivity and regulating and preventing post-meal spikes after
Got
meals.
it.
So movement after meals is great, but we'll get there. Okay.
Okay.
So food timing also becomes very important.
Yep.
The third thing is, so we talked about quality. We
Yep.
talked about food timing.
Yep.
The third piece is balance.
Mhm.
Okay. So making sure that our meals are properly balanced. A key secret to balancing and managing blood sugar is balance. When we have too many or too few or unprotected solo carbohydrates,
Mhm.
especially as liquids in the form of sugary
Yeah.
beverages, those can really drive your blood sugar too high or too low. So we want to make sure that we're planning meals and snacks that provide better nutrient
Got
balance.
it.
And what that means is we want to make sure we're including lean protein. So things like chicken, turkey, fish, eggs, tofu would be a great
Yeah.
example. Heart healthy fats in every meal and snack. So that could be in the form of things like salmon or avocado or olive oil, nuts and seeds, and high fiber carbohydrates coming from foods like vegetables, fruit, legumes, whole grains. Um, the balance there, that trifecta, really helps to slow digestion. It helps to increase satiety or fullness,
Yeah.
and helps to slow the release of sugar into the
Yeah.
bloodstream. So we never really want to eat carbohydrates alone. We want to make sure that our meals and snacks are properly balanced. And just one little example I can give you here is if you're somebody who typically has just say a piece of toast for
Right.
breakfast, okay? We might want to swap that for something like maybe some scrambled eggs mixed in with some fresh vegetables, maybe your mushrooms and spinach type of person, and then maybe some fresh fruit on this side.
Yeah.
So we always want to be thinking in terms of balance and including all three macronutrients, carbs, protein, and fat in the
Okay.
highest quality possible.
Okay. So
Okay?
quality, movement, and balance.
Quality, balance, and timing. We
Timing.
squeezed we squeezed movement in there for a second, but we're going to get to movement later.
Okay.
So just to recap from a nutrition standpoint, we want to assess the quality of the food. We want to make sure that our meals and snacks are properly balanced. And we want to make sure that we're following a regular eating schedule, eating at consistent times throughout the day. Okay?
Check. Yep.
We got that?
I've got it.
Okay. I'm going to throw one more thing on as it relates to nutrition because I think that this is also an important component that is often overlooked, which is the whole idea of mindful eating.
Yeah.
Okay.
Yeah.
We live in a world where we are all, myself included, eating on the go
Yep.
while we're serving our kids in the car, standing up. Okay. And that when we do that, we're really doing ourselves a disservice. So it's really important to practice mindful eating when you can, right? So you can break it down into smaller, tangible goals. Maybe you commit to eating one mindful meal a day, or maybe
Mhm.
it's three mindful meals a week, whatever works for you.
Achievable.
And
Achievable.
whatever is
Yep.
achievable, exactly. And the whole idea here is to really engage in mindful eating by savoring each bite, by appreciating the flavors and textures of your food.
Hmm.
And when you follow this approach, believe it or not, you're going to be more likely to make intentional choices. You're going to be better at recognizing your hunger cues, and you are going to foster a more positive relationship with food, all of which are really essential for managing your blood sugar and preventing diabetes and other health related conditions.
Yep.
So, mindfulness is a really key piece here.
Okay. Got
Okay.
it.
All
Yep.
right. Moving on to movement. So, this is another critical pillar that plays a big role in helping to manage blood sugar and prevent things like diabetes and other
Yep.
conditions. So, again, I touched briefly on how women at this stage of life, not all, but many of us, tend to be more sedentary.
Do you see
We
this
need to,
chair, Daria?
yeah, I
This is
know,
where I sit,
I know.
and you
Well,
see me all the time.
I'm sitting
And
on
I'm
one,
going to move
one
after.
too.
There she is.
Yeah, I'm sitting on one, two, and I am determined to get myself a standing desk or a
Yeah.
walking pad. I haven't done that yet, but it is definitely
Yep.
coming. So we really want people to be moving more and sitting less. Okay. We all know, I won't go into too much detail, but we all know the
Yep.
recommendations. Important to participate in at least 150 minutes of moderate intensity exercise every week. This could be in the form of walking or hiking or dancing or swimming or anything that you enjoy. But there are two other areas that, again, often I think are overlooked that are very, very important.
Hmm.
And maybe even more important than those 150 minutes of moderate intensity. One is strength training. Ladies, we've got to start lifting weights, okay?
Yep.
So the recommendation here is at least 2 to 3 days of strength training where you are working all of your major muscle groups. Strength training is critical for building and maintaining muscle mass, which naturally begins to decline at this stage of
That's right.
life. Okay. Your muscle mass, your skeletal muscle, is really key in maintaining optimal metabolic health, in managing blood sugar, and in healthy weight management as well. We know that skeletal muscle is key in managing blood sugar. It is actually the largest site in the body for glucose disposal,
Can we
meaning
pause here? Yeah, I was going to say this is a huge deal. So muscle, I'm gonna tee it up, and then in the most simple terms, having muscle, big muscles, strong muscles, more muscle, which as we go through menopause, and the statistic is staggering how much muscle is lost in that first part of menopause for women in particular, right? Like we're losing that muscular skeletal framework. Dario, what happens when we lose muscle?
So, well, when we lose muscle, we're again at greater risk for a lot of these chronic conditions, but also um, you lose mobility. You're at greater risk for falls and fractures and weakened bones, which can lead to osteoporosis. So, your skeletal muscle is really a key to overall metabolic health. And as I was saying before, skeletal muscle is the largest site in the body for glucose disposal, meaning it takes up glucose from the bloodstream and uses it for energy.
Yeah.
And this process is especially effective when you are active. Exercising muscles take up glucose even without needing as much insulin. So, this is my little push for moving your body. Even if you're not strength training, if you're sitting for extended periods of time, just getting up and stretching, or going for a short walk, or doing air squats, or taking that 10 to 15-minute walk after meals,
Yeah.
again, really helps with glucose disposal, helps to improve insulin sensitivity, and helps to better stabilize your blood sugar levels. So we really want to get ourselves moving. And, as I said before, this is such a pivotal stage of life. Maintaining muscle mass becomes much more difficult. With age, we naturally lose muscle through a process called sarcopenia, which is age-related muscle loss. And this really reduces the body's capacity to clear glucose from the
I
blood.
have
And
this
we know if glucose,
I have
yeah,
this vision
go ahead.
of like Pac-Man,
Yeah,
right? And your muscles are the Pac-Man that are just going to eat up all the bad stuff. I mean, not bad. I'm giving it a damning name, but you have the muscle is going to help your body reduce the things that need to be cleaned out, so to
yeah,
speak.
yeah. So strength training, really, really important. And then the final piece with exercise is just what I refer to as regular daily movement, incidental movement,
Mm-hmm.
taking the stairs instead of the elevator. If you're on a work call, do it while you're walking. You can invest in a standing desk where you can stand up and do your work. You can invest in a weighted vest. I know a lot of women are wearing weighted vests now. You can invest in a weighted vest, which can help you intensify your
Yeah.
workouts, or throw it on while you're doing household chores. The one thing that I will say is if you are new to a weighted vest, you may want to consult with your practitioner before you strap on the weighted vest. Um, but wearing something like a weighted vest can also be extremely beneficial. And then again, taking those little short walks after your meals
Yeah.
before you sit down to do whatever it is you're going to do can really help, again, with that glucose disposal, with eliminating some of the post-meal spikes that we can get after
Yeah.
mealtime. So those three components to exercise, the moderate intensity, the strength training, as well as the incidental or daily movement are really, really important. And then I'll just throw one other small thing there
Yeah.
is, I know sometimes women at this stage of life are trying to do everything they can to manage their weight and manage their symptoms. And sometimes that includes under eating, over
Fasting. Right.
exercising, fasting, and just to remind people that all of those things can create additional stress, which can cause, again, which can elevate cortisol, which in turn can elevate blood sugar. So we have to find the sweet spots where we're doing enough, but not overtaxing our bodies.
I feel
Okay.
like you keep coming back to this balance, which I feel like is so hard for women. It's like just have a balanced life or a balanced work-life balance. And I think that it really is true, whether that's nutrition or exercise or your stress levels, is checking in with yourself and
Right.
just getting back to that
Yeah.
equilibrium is really, really important.
And again, that's why I remind people you have to figure out the areas where you're going to have the biggest wins.
Yeah.
What can you accomplish at this
Yeah.
specific point in time? It doesn't have to be everything.
Yeah.
Okay. So just a few more tips and then we can move on. But I just
Yeah.
I don't want the time to pass without touching on sleep and stress. Um, so sleep is another big area that we need to prioritize, especially at this stage of life. It certainly becomes more difficult for women if you're struggling with hot flashes or night sweats,
Yeah.
or again, just taking on more than the body can handle. Sleep can easily be disrupted. So we need to do everything we can to prioritize sleep, to get good quality sleep consistently, day in and day out is
Yeah.
really important. Poor sleep, the bottom line is poor sleep can increase insulin resistance.
Yeah.
So we really want to make sure we're getting the 7 to 9 hours of quality rest every
Right.
night. And in order to do this, we need to think about how our daily routines are impacting our sleep habits. For example, are you having that 3 o'clock cup of coffee in the afternoon? The half life of caffeine is 6 hours.
Right.
Is that keeping you up, right? You may need to readjust your daily routine and your daily habits to promote better sleep, but also to think about your pre-bedtime routine, how you're setting yourself up for
Yeah.
sleep, and establishing good habits there. So I have lots of tips on my website, but really important to try to establish that pre-bedtime routine, shutting screens off at least an hour, avoiding stimulating content if you need to be on a screen,
Yeah.
um, you know,
Darkness,
practicing relax,
total darkness.
dark, setting up a bedroom environment that
Yeah.
suits you, practicing relaxation techniques before bed, whether it's breathing or journaling or light meditation,
Yep.
all of those things can really be
Yep.
beneficial. And then the same thing with stress. I've now talked about this a couple of times, the impact that stress can have on cortisol
Yeah.
and the impact that cortisol can have on blood sugar. So we also want to make sure that we're paying attention to our stress level and managing our stress. And that means incorporating some type of daily stress management technique into your
Yeah.
routine. And that can come in many different forms. It's different for everybody. Some people find yoga relaxing. Some people find deep breathing
Yeah.
relaxing. Some people find reading a book with a nice cup of herbal tea relaxing, or keeping
Yeah.
a gratitude journal. Um, or just doing something for yourself that you really enjoy. All of these things can contribute to better stress levels, but it's not an area that you want to ignore. It should be, it should definitely be
And
addressed.
finding that time, I think you began this saying, there's so many pressures coming at women, and we're not oftentimes not prioritizing self. And how do you create habit, going back to the book that you recommended, and having those moments of reflection or calmness are important.
Mhm.
Perhaps just as important as moving your body and having balanced nutrition and having good sleep, but having those moments of calmness and bringing down that stress is really, really important
Yeah,
as well.
yeah. So those really address the key pillars.
Mm-hmm.
There are two other suggestions that I
Yeah.
have
Yeah.
that women might want to consider also moving forward. One of them is monitoring your blood sugar. If you're at all concerned about how food and your lifestyle choices, things
Mm-hmm.
like stress, sleep, environmental factors, may be impacting your levels, more and more people are turning to continuous glucose monitors, which I will often recommend to certain clients. They can be very useful, provides real-time data, again, so that you get insights into how the different foods that you're eating, as well as how your sleep, your stress, environmental factors are influencing your blood sugar. And the goal really is we want to try to work towards more gentle, rolling blood sugar levels,
Yeah.
as opposed to, it's not going to be flat. Your blood sugar is never going to be flat and even, but we want to try to
Yeah.
avoid very rapid spikes and very rapid drops and create those more gentle rolling hills. And all
And,
of these things, the balance, the quality, the timing, all of these things, the movement will help to create those more rolling, gentle hills.
and for those people who don't know what a CGM is, a continuous glucose monitor ostensibly was created for type 1 diabetes, type 1
Yeah.
diabetics, to constantly check in on that glucose
Mhm.
and manage it, because their bodies don't work in terms of keeping that balance going. And so a CGM for type 2, or people who just want to understand what that
Right.
up and down is looking like, it is a device and a certainly something that's becoming, we're seeing more and more in terms
Mhm.
of integrating into normal and customary nutrition conversations if you're working on that. So,
Yeah. And the real time feedback can be very, very valuable. Usually you wear it for about 2
mhm,
weeks. Um, and most of them come with apps where you can input your food and your other
mhm.
lifestyle factors, and it gives you real-time data. So that's something that your doctor can write you a script for. It's definitely worth having a conversation. If you're at all
Yep.
concerned, definitely worth having a conversation and getting a script for that. The other thing is making sure, as you go for your annual doctor's visits, to make sure that you're keeping track of certain biomarkers. So it's important to, you may be able to go back and look at labs that you've had, or if you have an upcoming appointment, to keep eye on certain biomarkers,
Mhm.
which can give you a clearer picture of your overall metabolic health. And those would be things like your hemoglobin A1C, which is a 3-month average of your blood sugar level, your fasting glucose, things like fasting
Mhm.
insulin, your blood pressure, your triglycerides, your HDL cholesterol, which is your good cholesterol, and waist circumference. All of these things can really give you a clear picture of your metabolic health and can help you guide changes in your lifestyle and or medication if you're on medication. But important to be proactive and to keep track of
And
those.
Daria, do you recommend your patients going in and advocating for self and saying, I would like to see my X, Y, and Z, please?
Yes, and those specific
Mm-hmm.
biomarkers are on a regular
Most panels.
annual
Yep.
panel. Yes, so you should be getting those every time you go for an annual visit. Um,
And if you're not, ask for it.
Definitely if you're not asked for it. And if you have questions, I would encourage you all to have your doctor explain what the numbers mean, and to also take note of, even if your numbers are within normal limits, to compare to years
With the
prior to see
line.
what the trend has been, right? I
Right.
mean,
That's right.
that's also important too, and that can be really, really valuable information to have.
Wonderful.
Okay.
Um, Daria, this has been so eye-opening, and I'm gonna have to just go walk and then come back and not be sedentary. And then I'm just gonna just do some laps around my house. It's no big deal. But how can people who are watching get in touch with you? And do you see patients virtually? Do you see people in person? How does that work?
Yeah, so as Melissa said, I just relaunched my new website, which is dariard.com. So people can reach me just by going to my website. There's a contacts page there. People can DM me on Instagram. I am seeing clients nationwide. I do most of my work virtually. So happy to answer any questions that people have. But I also have a lot of great resources on my new website. I have a whole menopause toolkit that has tons of resources,
Yep.
including specific tools that I use with or recommend and use with a lot of my clients. That's all in my menopause toolkit, plus a blog section and a recipe section. So I would encourage you to go check out the
It is
website and explore.
it's a
And
treasure trove.
if you,
It's amazing.
thank you. And if you have questions, feel free to reach out.
Wonderful. Well, thank you for everything. Stay warm, stay
Thank
healthy.
you. Thank
Hope
you.
you avoid the flu.
Me
And
too.
take care of your family. And we're so grateful for you as always.
Thank you. It was great to be here. Thanks for
Okay,
having me.
bye.
Bye.